We have three speakers. I would like to introduce the speakers first, short introductions. From the Philippines, we have Mr. Joel Atienza. He is a technical component manager of the Global Fund Round 6 HIV project. He is also a technical officer of the National AIDS and STI Prevention and Control Program of the Philippine Department of Health. He holds an MPH degree from the University of the Philippines, Manila, and recently Program for Development Managers at Asian Institute of Management. His experience includes 15 years of government services in the field of health research, clinical laboratory, health policy development, and HIV-AIDS. Our second speaker is from Malaysia. Dr. Karina Razali is a freelance independent consultant for HIV-AIDS. She holds a PhD in mathematical modeling of HIV and hepatitis C virus epidemic in the Asia-Pacific region. She taught epidemiology and biostatistics at the Department of Social and Preventive Medicine at the University of Malaysia between 2000 and 2004. She is also the research support advisor at the Center of Excellence for Research in AIDS at the University of Malaysia. Our third speaker is from Indonesia, Ms. Hesti Armiwulan. She is a deputy chairperson for External Affairs of the Indonesian National Commissions of Human Rights. We will start with the 15-minute presentation from the Philippines. Mr. Atienza, please. Mr. Atienza, we will start with the Philippines first, and then we go to Malaysia, and then Indonesia. Mr. Atienza, are you with us? Okay.
Yes, I'm ready.
Okay, I will operate the slide presentation from here. So just okay, you can start. Your first slide already. Yes, Mr.
Yes,
Tenja, please.
can you give me the first slide? Okay. So, okay. Good morning. I cannot see the slide from here, but can you help us? Okay. Can you bring back the first slide? Okay. Good morning from Philippines. I'll be presenting to you the experience of the Philippines in terms of reducing stigma and discrimination. So I have with me a co-presenter in the name of Mr. Roberto Ruiz from Positive Action Foundation. I will hand in the microphone to him for some introduction.
Good morning, everyone. I am Mr. Roberto Ruiz. Good morning, everyone. I am Mr. Roberto Ruiz, representing Positive Action Foundation and also representing the positive community. I am HIV positive and living with the virus for 18 years now. Thank you.
Okay, thank you, Bobby. Next slide, please. Okay, the outline of our presentation will be the following. First, the policies and context. Second, we will be sharing with you our experience as far as the Global Fund Round 6 HIV project is concerned. Third, community representative perspective in terms of meaningful involvement of HIV to be given to you by Mr. Ruiz. And of course, the recommendation for future action. Next slide, please. So for the scope and limitation, basically the Philippines response is headed by the Philippine National AIDS Council, as had been presented to you in previous sessions. The health sector response, on the other hand, is led by the Department of Health, which is the organization that we belong, particularly the National AIDS STI Prevention and Control Program. The scope of this presentation will be a discussion of the activities of the project as how it relates in trying to reduce stigma and discrimination. Hence, the limitation of this presentation is that it is quite limited in the health sector response. Of course, the country's response is bigger than the health sector response. Next slide, please. Okay. This is the current epidemic in the Philippines. We're classified as low-level epidemic. The reported case of HIV in the country is 3,600 plus. So the estimated number of people living with HIV in the country is around 7,500. If you can see from that report, basically there is almost 50% underreporting. Why is that so? Maybe a factor contributing to that may also be stigma and discrimination. The epidemic is affecting mostly the females, but increasingly the males are also being affected, and of course it also is among the most at-risk population. We are a low-level epidemic, but the cases are also alarming in terms of its increase. As you can see in this graph, that in the last 3 years, we have been a very sudden increases in terms of the number of HIV-AIDS, HIV infections reported to the Philippine Department of Health. Next slide, please. Okay, so we have this, we'll be tackling the issue on two levels. One is the legislative mechanisms that the Philippines instituted to reduce stigma and discrimination, and the other one will be on the programmatic in terms of the activities currently being done to contribute to the reduction of the stigma. So, under the Republic Act, which is the national law, in terms of HIV prevention and control, there are some provisions that specifically addresses the HIV concerns in the country. One of the major provisions there is that the strengthening of the Philippine National AIDS Council, the establishment of a comprehensive HIV-AIDS monitoring system, and instituting a nationwide HIV-AIDS information and education program. Next slide. Okay. Under this Republic Act, or our national law, the following are part of its provision. Persons has a right to HIV information and services. So each healthcare worker should be ready to provide accurate and relevant information to individuals accessing the services. There is no mandatory HIV testing in the country. It is also required for the client to undergo a pre-test and a post-test counseling before HIV testing. And then, unsafe practices and procedure, the law itself provides penalties for unsafe practices and procedure, and this is very clear in terms of what would be the penalty if you will violate these unsafe practices. Confidentiality of records, basically it's also stated in the Republic Act that confidentiality should always be ensured, especially for people living with HIV and AIDS. Next slide. Okay. To prevent discrimination, the following are also stipulated in the Republic Act of the country. PLHIV, or people living with HIV, cannot be denied of any of the following. 1, employment and livelihood, admissions in school, travel, appointed position, credit and insurance, healthcare, and of course, decent burial services. So these are all reflected under the Republic Act. Next slide. Now I'll be talking about the project. Basically, the project that we will be discussing is the Global Fund Round 6 HIV project, and this is implemented by the National AIDS STI Prevention and Control Program in partnership with Positive Action Foundation and Pinoy Plus Association, both PLHIV group organized in the country. Next slide. The project is focusing on 16 major cities nationwide, and it also is coordinating with 13 treatment hubs or the major hospitals providing antiretroviral drugs and patient monitoring in these government hospitals. Next slide. So, during our initial data gathering, when we asked some of our stakeholders and asked them what forms of stigma and discrimination you actually experience or you feel that you are experiencing. Among the entertainers and commercial sex workers, well, basically, some community leaders or key officials considers sex work as immoral and also illegal. Among males having sex with males, the most prominent one is we do not have services for them, since the special STI clinics that the Philippines has caters to the female entertainment establishment workers. When we ask among the injecting drug users, well, basically they are being considered as outcast and of the society and is illegal also. Among the PLHIV and their significant others, still they feel the culture of blaming why they get the infection, and being HIV as it is also some of the reason why people are being discriminated. Among PLHIV, there is some cases wherein hospitals would refuse some PLHIV because of inavailability of some services for them. There is also some reports of special burial arrangements, which we feel should not be the case. Next slide. Okay, the next slide actually is the framework that we are using in this project. Basically, we are trying to provide relevant information to the information gap. As you can see, we would like the people to become more informed, both the at-risk population or the low-risk population. We would like also to reduce stigma, to livelihood, and all these things. And of course, the last thing is make services available to all of our PLHIV and most at-risk population. All of this will contribute to the reduction in HIV the general public. Next slide. So what we would like to achieve, basically we would like to reduce the HIV prevalence in the country and mitigate doing it in these three main activities: providing antiretroviral drugs and monitoring, basic and psychosocial support, and stigma reduction seminars in all settings. Next slide. So, in terms of ARV provision, the country is quite successful as of now in terms of providing ARV at the public health facilities. So, as you can see this slide, there has been a tremendous increase in the number of people now being covered by antiretroviral drugs. Next slide. And of course, basic services and psychosocial support. The project and in general, the country is providing counseling and psychosocial care. We are also started out a self-empowerment training for the PLHIV to capacitate them. And then livelihood and cooperative development. Of course, stigma discrimination will also be lessened if they will be capacitated financially also. Next slide. So this is just some of the things that we're doing. Next slide. At the hospital level, we provide information to the, training to the healthcare personnel. Next slide. And what are we trying to achieve here? We would like to, of course, sustain and achieve that 100% of the people living with HIV will be accessing the services available. This includes treatment and care and support services. And then we would like to reduce cases of reported stigma and discrimination. And we would also would like to empower the PLHIB as a community and as an organization and as an individual. So what are some of the opportunities that we have in the country? The law itself provides us some opportunity because it provides a good policy environment in terms of the basis or the policy guidelines. But we also have an organized PLHIB community and a strong civil society. This contributed also to some of the opportunity. And of course, the increasing strengthening of the services for our PLHIB is also gaining support from the government, also from the. What are the challenges? Of course, the numbers are increasing, as you can see in the graph. No? Sustainability of some of the key services will also be a factor later on. And the prioritization is also being a low-level epidemic also, there is also this risk of complacency in terms of response and providing the right actions. Conclusion. Basically, stigma is driven by lack of information, basic information. The information should be rights-based, it should be accurate, and it should focus not only on the targeted group, but also in the general population as well. Practices, this is still happening, although this is not very much documented. And empowering the people, the PLHIB, will be providing the necessary tools for them so that they can report this and they can, the government and the civil society organization can address these concerns. And lastly, meaningful involvement of the community members is very, very much critical.
Incorporated in Pinoy Task Association are the implementing partners of the Department of Health under the Global Fund Round 6, focuses on the treatment, care, and support, scaling the treatment, care, and support to people living with HIV/AIDS. Positive Action Foundation, or PAFI, the organization where I belong, is a care and support organization for PLHIBs with a vision of empowering PLHIBs and their affected family living a normal life in the mainstream of supportive society. Its mission is to contribute to the national response in advocacy, prevention, treatment, care, and support for people living with HIV/AIDS, affected family, and significant others. The Pacific community in the stigma activities being conducted by the Department of Health under the Global Fund Round 6 in the hospital settings to the participants, to the stories shared by a person on the actual experience of discrimination. Because of this, the participants give more attention on the issues being tackled, which sometimes actually happens in their own hospital. Our meaningful involvement as a person living with HIV, also help us to become empowered. We were able to realize our self-worth, and then second, we were also that we can still do something for our community, but not only for the positive community, but also to the improvement of the health services. Our involvement as an NGO, we were given a chance, our part in the national response to reduce the stigma and discrimination in our country. On the part of the hospital staff's trained, we were able to help them to become more friendly to HIV patients. And lastly, on our part, as people living with HIV-AIDS, more are accessing, or maybe it is increasing now, those who are accessing to the hospitals that were provided this stigma and discrimination training, and we were also given more options. And thank you.
Okay, thank you.
The presentation. Thank you so much.
Okay, thank you, Mr. Atienza and Roberto.
Of Malaysia with regards to stigma, discrimination and human rights. What I will cover is environment in Malaysia, who are the marginalized communities and how are they affected by stigma and discrimination, the policies and the law that are related or affected through HIV, the issue of religious and moral sensitivities in a country like Malaysia, the role of the media, the impact of the epidemic, and our response and efforts so far. Okay, next slide please. I've covered in detail the situation of HIV in Malaysia and some background information about Malaysia, but just to recap, Malaysia is a population made of about 27 million people, and it's multiracial and multi-religion, which is a key issue when dealing with HIV response in the country. The prevalence estimated currently is 0.5% among the general population, but Malaysia is also classified as a concentrated HIV epidemic country, which means that although among the general population the prevalence is low, the level of HIV prevalence is actually high beyond 5% in certain subgroups of population, namely the injecting drug users, female sex workers, as well as the MSM population. Up till the end of 2008, we have over 84,000 reported cases of HIV and AIDS. Next, please. Okay, so Malaysia is predominantly a conservative population, a conservative nation. It is officially a Muslim nation. But there is also an increasing urbanization and changing lifestyle and values, particularly among the youth and in the urban regions. So what we are seeing is an increasing gap between the rural and urban communities, as well as communities between different social economic levels. So it is really a country in transition, and what we are seeing is intergenerational gaps as well as gaps in values and lifestyle. Next, please. With regards to marginalized populations, I've mentioned those who are most affected by HIV and AIDS in Malaysia are the men who have sex with men, MSM, transsexuals and transgenders, in Malaysia we call them matnya, sex workers, we've got female sex workers as well as male sex workers, and injecting drug users, who are the key population driving the epidemic right in the earlier on in the early 1990s. So there are taboo related to the issue of both the disease as well as the marginalized populations. And another factor that's underlying the taboo, discrimination and stigma is also the illegal nature of risk behavior associated with these populations. Next, please. So a quick run through of the definitions. You've probably done this already, but stigma is related to the unfavorable attitudes and beliefs. And when we talk about HIV and AIDS, there's actually two levels of stigma. One is related to the disease and the infection itself, and this is a lot to do with lack of knowledge and low awareness. People don't know how HIV is transmitted and how it's not transmitted. So that lack of knowledge and awareness about the disease itself puts us at a high level of stigma to people who are living with HIV and AIDS. But there's a second level of stigma, and this is related to the groups who are affected with HIV and AIDS based on their behaviors and the stereotyping of these groups. So people who are men who have sex with men, transsexuals, the matnyas, injecting drug users. So even without HIV and AIDS, they are already faced with stigma and discrimination. And coming on to discrimination, how that relates to stigma is that discrimination is actually the actions that are taken against a group and person based on the existing prejudice. So that leads us to the issue of human rights, how we want to promote that everyone, regardless of their behavior or their risk category or disease status, with HIV or without HIV, everyone should have the basic rights to human basic rights. And that includes rights to freedom from discrimination, rights to health, rights to dignity, privacy and equality. Next, please. So more than 1,000 adults in 3 urban cities in Malaysia, and this included a focus group discussion of about 130 people living with HIV/AIDS. The people surveyed, 48% responded that they would be ashamed if a family member has HIV/AIDS, and this is very much the general attitude. HIV/AIDS is related to shame, to the family, to the community. And we also had several issues in the past where several statements made by individual leaders who are quite high profile to more stigmatization of HIV and AIDS. Statements are in positions such as HIV positive people should not be allowed to marry or have children, and another person said that people living with HIV or HIV carriers should be isolated on an island so that they do not infect others. So this kind of high-level stigmatization has an impact on the general population, and it further increases discrimination against people with HIV. There is also that general attitude within the mainstream population, where HIV positive people and AIDS patients are seen as either sinners or victims. Sinners are those who ask for it, who deserve to get infected, whereas the victims are the innocent wives and the children. So that level of stereotype barriers to HIV prevention and intervention, and as well as creating a bigger discrimination against people with HIV. There is also anecdotal evidence of stigmatization and discrimination at the workplace, and as well as among some subgroups of healthcare personnel, where the healthcare personnel themselves have differing attitudes towards patients who are HIV positive. Next, please. The law and policies in Malaysia also can present as a barrier to intervention efforts when it comes to HIV and AIDS. Anal and oral intercourse are illegal based on the Penal Code 377, and this creates a multitude of complexities when trying to create awareness programs or prevention strategies, because it's hard to acknowledge the populations when they are actually already considered illegal. And recently there was also Sharia laws sites on the views on cross-dressing, so that creates further stigmatization. And Malaysia recently, in the beginning of 2009, started the premarital mandatory testing for Muslim couples, and the nation is pretty much divided about this issue. On one hand, a lot this is strongly seen as protecting the innocent from getting HIV infection through spousal transmission. But on the other hand, a lot of people are also, especially the NGOs and people representing people living with HIV, this is seen as a violation of rights to privacy and confidentiality. Previously it was initiated in a few states, but at the beginning of 2009, premarital mandatory testing has been enforced throughout the nation, but it is only for Muslim couples for now. Drug laws are also, there is a zero drug policy in Malaysia, but that again creates a difficulty in addressing the issue of HIV among injecting drug users. Next, please. Coming back to the issue of mandatory premarital HIV testing, the key points of objections to this policy is the fact that it is mandatory, whereas most NGOs, most people groups representing people living with HIV will be in full support of a voluntary counseling and testing option instead.